Well, let's start punctually. Good afternoon, ladies and gentlemen. Thank you very much for attending this press conference. Let me first and foremost welcome you on behalf of the United Nations Information Service for coming here, and more so, of course, on behalf of the United Nations Scientific Committee on the Effects of Atomic Radiation. We have an illustrious expert panel here. I will pass on the floor very soon to them. Just very shortly, a brief introduction. I think based on the media advisory that you received, you are hopefully very clear why you are here. This is the last day of the 60th session of the committee, and we are going to focus on, or rather the experts are going to focus on, two reports that the committee has been dealing with. One is on the effects of radiation exposure as far as children are concerned, and the other one is a report on radiological impact of the Fukushima Daiichi accident. The committee, which has been meeting here for the past week, is serviced by a dedicated expert secretariat that is permanently housed here at the Vienna International Center. The head of that secretariat is Malcolm Crick. Malcolm will talk to you first about the Secretariat and Unscare. We'll give you a brief crash course on what Unscare is about. And afterwards, the floor will be passed on to Mr. Carl Magnus Larsson, who is currently the chair of the committee. He will highlight the current work of the committee and will also underline the significance of the two reports. After that, you will hear brief introductions and overviews of the significance, importance, and findings and outcomes of the two reports by the two experts who pulled together the two reports, who are responsible for the two reports. First, it'll be Mr. Fred Mettler, who is the one responsible for the report dealing with children. And then afterwards, it'll be Mr. Wolfgang Weiss, who was the one responsible for putting together the report on Fukushima. So with that, I'm going to pass on the floor to Malcolm, please.
Thanks, Janos. Good morning, afternoon, isn't it now? Yes, to everybody. We've had a very busy week. Let me just give you a little background to what Unscare is. Unscare is a scientific committee on the effects of atomic radiation. It's a scientific committee established by the General Assembly of the United Nations, and it reports to that General Assembly. It comprises 27 member states of the UN that have been designated members of that committee, and it meets annually here in Vienna. This week we've had something like 180 people in the session, reviewing and revising the documents of the committee. Within the mandate of Unscare, we focus on the levels and effects of ionizing radiation exposure. The committee has no role in the application of that advice. It is purely scientific. It provides scientific information that is then used by other organizations or governments for protection standards. But this committee makes no judgment on those standards. I don't think there's anything more I need to say, really, in setting the scene. I'm quite happy to answer questions if there are any points of detail on that later.
So, Mr.
Well, thank you very much, and good afternoon all. I will just make a very brief introduction to what has been going on during the week. Obviously, the committee has met during the week to discuss two major reports, one on the radiological impact of the Fukushima Daiichi accident, and that will later be introduced by Dr. Wolfgang Weiss, sitting beside me here, and the other being the effects of radiation exposure on children, which will be introduced by Dr. Fred Mettler. Now, obviously, Fukushima has been discussed very much in relation also to the Chernobyl accident that occurred in 1986. And there are many similarities, but there are many differences. I think that one of the main similarities, of course, is that these were two major nuclear accidents that caused the evacuation of many people, 100,000 more, from the areas. And that has in itself had a very significant health impact in terms of the social and mental well-being of the population. And we can see that already in Japan, that this is a consequence that we are dealing with, or the Japanese authorities are dealing with. Because this is not strictly, obviously, within Unscare's remit, because Unscare, as was pointed out earlier here, work on the sources and effects of radiation. Now, there are many differences between these accidents as well that will be described a little bit more later in terms of the radiation exposure and implications for health. And that relates both to the workforce, to the environment, to the general population, and of course to children. And the children report was a work that started already in 2010. So that started before Fukushima, and then 2011 we had a Fukushima accident. But the committee considered the issue of effects of radiation exposure on children to be important and continue to progress this report, and that's why we this week have been able to discuss the findings of both of those reports, and we are going to move forward towards their publication. It's long been recognized that there are differences in sensitivity to radiation exposure between children and adults. Question is, how big is the difference and what are the differences? And that's what Dr. Mettler is going to expand on. Just want to finish by saying that we have been discussing the content of these reports. We have agreed on the scientific findings. There is still work to be done. Supplementary material has to be put in the report, and there's editing that needs to be done. It means that we do not have the final answers to everything today. We are looking forward to publication later during this year. But there is outcomes from the meetings that we can discuss, and I think we should start doing that now. So I don't have anything more to add. I suggest that we just hand over to Dr. Fred Mettler to talk about the children report.
Thank you. The Unscare Committee has long been interested in what we would call vulnerable populations. So are there groups out there that might be more sensitive to radiation than others? And it is very easy to recognize children as a different population, and of course most people understand that they are more vulnerable. So we were interested in putting together a document on this. One of the issues in the beginning is that at the present time, until this report, there is no one place you could go to look at a document and say, I'm worried about children and radiation. What are all the effects in one spot? You would have to go to different documents and start pulling out the children's information from many, many different documents. So this document is really the first of its kind, and I think will be a unique resource for those people interested in radiation effects on children. Also, the effects of childhood exposure may not only occur during childhood, but may occur when you're an adult. So we had to consider those effects that would occur immediately or within several years or even many decades later. The committee struggled a little bit with what is a child as a definition. And of course, one can find many different definitions. We ended up including information on infants and children, and actually even adolescents, pretty much carried up to around the age of 20. The interesting things turn out to be that there are differences, of course, in what happens in terms of effects, because the children are significantly different from adults anatomically. The proportions of the bodies are different. The physiology is different. There are differences in children because there are developing tissues that aren't developing anymore in adults. So you can imagine that there would be some different effects. Also, the doses are different. So if I were to put an adult in this room and a child in this room and have some source of exposure, they don't get exactly the same doses because of lots of things, their stature, their size, and so forth. And certainly the physiology is different. Even if I put them in an environment, they eat different things and so forth. It turns out that we then examined cancer sites specifically. In the past, the committee has said that children might be 2 or 3 times more sensitive than adults, but that was really a general statement, and it wasn't related to specific tumors. And when we examined the 23 different tumor sites, what we discovered after we delve into the literature is that children are clearly more sensitive than adults in terms of getting tumors induced for a number of tissues, including brain and breast and thyroid cancer. There are a number of sites for which they are pretty much the same as adults, like colon cancer. There are some sites where they're actually less sensitive than adults, and there's a number of sites we just don't have enough data on to tell much. We also then examined effects, not just cancer induction, but we had on our consultant group a pediatric radiation therapist, and the complications that one gets when doing radiation therapy on children to cure tumors has many different effects than it would in adults. And as with the cancer risks, the risks that occur to the tissues from high doses are also variable between adults and children. There are some tissues, again, that are much more sensitive, particularly the developing brain in children. And there are some tissues, interestingly enough, like the ovary, that are more resistant than in adults. So at the end of the day, we ended up saying that if you really want to know the effects, you can't just take an average of 2 to 3 and assume that's what's going to be happening. And one really needs to look at each specific condition and exposure scenario to tell. And as an example, one might say, what about Fukushima in children and radioactive iodine that's there or was there? Well, we all know that children have a completely different diet than adults, so that would make a difference to what happened. Children have different ingestion rates and different absorption rates of iodine than adults do. The thyroid takes up more than adults do. The doses, even for the same amount of iodine, are different than in adults. And we know that actually the cancer risks for the same dose are higher in the children. So all those things make a difference. And in order to figure out what's going to happen, you just have to go to each one of those things individually. And I think our message is, if you're worried about children and effects, you really just can't generalize. You have to look at the specific areas. We also gave, finally, some areas of research that we suggested. Thank you.
Yeah, thank you. I would like to start with a personal statement. It hasn't been a busy week only. It has been a very busy 2 years of many experts, and I will tell you a little bit more of this expert group, to develop this draft report, which has been discussed and scrutinized by the committee this week in great detail, and it was very helpful to have this feedback from the committee. But after this peer review of the draft report, I think we have reached a milestone in Unscare's efforts to assess the levels and effects in the aftermath of this accident. The peer review has been done by 27 member states of the United Nations and some 180 experts within their delegations. The expert group has been tasked by the committee to modify and further develop certain areas. So the work is not over, but we have an agreed timeline to finish this work in summer, so the report can be published later this year. When it is published and completed, I think this is, to date, the most comprehensive scientific analysis of the information we have now. This does not mean we have got everything we wanted, but if you have a deadline, you have to live with what you have at a given time. The report was developed by some 80 scientists from 18 countries all over the world, backed by some 200 scientists in their organizations. And Unscare received huge amounts of measurements, mostly from the environment, which were received from the government of Japan, from institutions in the country and outside, from 5 international organizations, namely the CDBDO, the FAO, IAEA, WHO, and WMO, and from the peer-reviewed literature. The experts had to do extensive model calculations because in the early phases of the accident, little measurements were available, and there were gaps in the measurements. So we had to close these gaps to get a complete picture on all the pathways and all the relevant dose contributions, both to the population and to the workers. The committee at the end of the week concluded that radiation exposure following the nuclear accident at Fukushima Daiichi NPP did not cause any immediate health effects, and it is unlikely to be able to attribute any health effects in the future among the general public and the vast majority of workers for which those histories have been assessed. The committee also concludes that the actions taken by the authorities early on to protect people, namely evacuation and sheltering, significantly reduced radiation exposures that would have otherwise been received, and the reduction is by as much as a factor of 10. The two most significant radionuclides characterizing the situation are iodine, 131, and cesium. The doses delivered by these radionuclides to the population and the workers were quite different. Doses to the thyroid by iodine 131 received by the 1-year-old child ranged up to several tenths of milligray and were received within a few weeks after the accident. The whole body dose in the population, mainly from the 2 cesium radionuclides, ranged up to 10 millisievert, and these doses will be received over their lifetime. The additional exposures received by most Japanese people in the first year and the subsequent years due to the radioactive releases from the accident are less than the doses received from natural background radiation, which is 2.1 millisievert per year in Japan. No radiation-related deaths have been observed among nearly 25,000 workers involved at the accident site. Given the small number of highly exposed workers, it is unlikely that excess cases of thyroid cancers due to radiation exposure would be detectable in the years to come. Special health examinations are given to these workers, especially to the workers with exposures above 100 millisievert, as a means to monitor for potential late radiation-related health effects at the individual level. With this, I would like to end my statement. Thank you.
Thank you very much, Mr. Weiss. Yourself and the media you represent as a courtesy to our panel members and, of course, to your fellow media representatives. Please, the floor is yours. Any questions? All right, then I'll break the ice because I did get one from the New Scientist, from reporter Andy Coughlin. What he's asking is, and this goes to Mr. Weiss, is what are the most serious immediate and long-term threats to health that Unscare has identified? And a follow-up, when will people be able to safely return to the area, if ever?
Well, these are two very different questions, and I would like to answer them one after the other. So far, we didn't see very serious immediate health effects. We didn't see deaths. We didn't see major effects. We saw high doses with 2 workers for the thyroid, which were high enough to follow up with medical procedures, but the follow-up was positive in a sense that the doctors didn't see malfunctions of the thyroid. And that's it. We didn't see major things we saw after Chernobyl, where we saw overexposures leading to death and very critical health situations. So this is the first thing. The second thing was?
When can people safely return, if ever?
Well, I mean, there were 2 answers again. The first answer is there's a balance between the benefits to go back and the risk you have due to the radiation which is remaining in the city. And there are many different areas in Japan with many different levels of exposure. So this has to be decided on a case-by-case basis. The Japanese government has taken a position with that, but this is not for Unscare to judge. I mean, they have defined numbers where they think the balance is positive and they ask people to go back. So the dose assessment will help to implement decisions of this kind, but this is not an issue of Unscare to help. We can only provide basic information which can then be used by the organizations involved.
Thank you on behalf of Andy Coughlin from the New Scientist. So that was the first question. Andy was brave enough to do that, so here we go, please. On the side where it says Mike.
Ishiguro of Yomiuri Shimbun. So Mr. Weiss pointed out that there is no significant health effect immediately, and in the future it is not able to trace the impact of this incident for the health. In this case, in comparison to Chernobyl, how could you evaluate this is 1/10 less significant or 1/30th less significant or things like that?
Well, number one, we are talking about radiation-induced health effects. We are not talking about other effects which are related to the radioactive environment. This is a difference because all the psychological things which are ongoing have to do with the situation involving radiation, but are not a direct impact of the radiation. After having said that, I forgot the real question.
In comparison to the Chernobyl.
Yeah. Well, I mean, the health risk has to do with the level of dose received. And the doses received after Chernobyl, particular, for example, to the children, the thyroids, they were much higher than the doses we have assessed in Fukushima. And this is the whole difference. If you have low doses, then the risk is low. And if the risk is low enough, then you cannot see any increase of risk due to radiation because the baseline of this typical cancer you're looking at is varying in your country and with time. So if this within the variation, it's difficult to see an increase due to the radiation.
Floor is open. Seems that our experts have covered everything. Yes, please.
My name is Ken Udagawa from Kyoto News, Japanese news agency, and I have a question about the concrete number of the several tens of milligrade. Do you find the many children and many include and many adults were measured, I think, in the hospital as some organization, and what is the most figure of the exposed dose to the people for thyroid and for whole body.
Are you talking about
Yes.
the worker, or are you talking about the
Not the
population?
bulk, especially the highest figure of dose exposed dose to
an
people,
adult or to
to
a
adult
child?
and to children.
Okay.
The both.
Well, let me explain what we did, and then I answer your question. At the beginning, we didn't have the measurements from the people in your country, neither for the children nor for the adults. In the meantime, during the recent months, we received that. So we did model calculations, and in the late phase of the development of this project, we compared them with real measurements. And we found out that there's a difference, there's a tendency for the model results to be higher than the data from the measurements. In the early times with the thyroid measurements on the children, this cannot be repeated. So we have to live with an uncertainty between the measurements and the model results. In the later phase, where we have the cesium, we can more and more rely on measurements in the population. But given the time constraints, we could not fully exploit that. So in this context, what I can say is, for the children, I told you the thyroid dose, the organ dose, is to us the critical pathway. Fred Mettler talked about that because they are more sensitive than adults. And there we have seen values up to 66 milligray organ dose. But if you look at the measured distribution, you can see that the measured distributions have a lot of data which are below detection limit even. They are very low. So this one high value does not give you the full picture. This is for one case, and we think that this is really something which pins down the range for the time being. We don't expect to have doses which are factors or an order of magnitude higher when we continue to analyze the situation. For the adults, we have in the most affected areas, we have doses up to 15 millisievert the first year, and during the lifetime, up to a factor of 2.5 more. But again, if you calculate the lifetime dose, you have to assume something on the future development. Do they stay at the same place where we calculate that? Do the remediation measures, the cleanup measures, reduce the future doses? So the lifetime doses are very uncertain, but the dose for the first year are up to these 20 millisievert, and this is. And given these levels of dose, we make these statements because we have not seen risks and health effects in populations at this dose level ever.
Are there more cases of cancers from children now after the accident?
Well, number one is we have this screening with ultrasonic techniques, highly sophisticated new ultrasonic techniques on children. The Fukushima Health Survey uses this technique because you cannot measure the impact of the iodine anymore. This is decayed away. So they are looking at the situation of the thyroid of these children in the affected areas. And what they see is a very high number of small nodules and cysts, a very high number compared to other investigation of this type with less precise measurement techniques. But if you go to areas like Hong Kong, where they used the same techniques, they found even higher numbers of these cysts and nodules. And so right now, nobody knows what this means, if this is just reality which never manifests in a health risk, or if this really develops into a thyroid cancer. What we generally know is if you do screening, which you didn't do before, the numbers you observe go up. But they are not necessarily related to the radiation at the spot. And the second thing is, we have seen after Chernobyl that there is a certain delay of 5 years until such an increase develops. And the argument of the health survey in Fukushima is this is too early. These anomalies, if they are anomalies, they cannot be related because the time difference is too small. This is where it is. This will be continued. We will have to expect, because they are now looking very intensively into this question, we will have to expect that more thyroid cancers will be identified, but they are not necessarily related to the exposure to radiation.
Is Veselka Marinova. I'm from Bulgaria newspaper Presa. My first question is how you compare Chernobyl and Fukushima. Is it possible to tell us how many people in Europe are related with developing cancer after Chernobyl in Europe? Because all people in Europe were affected, first question. And my second question is, you are talking about nowadays, but what will happen with these children in Japan when they are eating fish, when they are eating rice, and all is damage with this radiation? Can you explain how you find that it's not dangerous radiation, but after 5 years you cannot relate it with radiation, any cancer cases?
Well, we don't compare Chernobyl with Fukushima. We assess Fukushima and we assess Chernobyl independently. And the assessment of Chernobyl are documented in a couple of Unscare reports, and all the details you're asking for are there. As far as the ingestion pathway for children is concerned, this has been included in our assessment so far. We include all pathways: external exposure, inhalation, and ingestion. And you know there are food bans in place with maximum allowable concentration in food, which are based at the end of the day on consumption rates and a dose, which is 1 millisievert per year through ingestion. So this is the way how administratively the ingestion dose is supposed to be reduced or limited.
Yes, thank you. The second question was for food. Yeah, I got the answer.
So do you have a follow-up question to what you asked? Or you have your microphone on, that's all.
No, I don't have.
Could you maybe point out again who did what after Fukushima accident to limit the effects of the radiation?
Well, it was a decision of the federal government in Japan to initiate evacuation, then to initiate sheltering. And this was executed by the local authorities. Does that answer your question?
Theoretically, yes, for use in video, news video. Not really. Never mind. Thank you.
Microphone, please.
Well, I mean, the history, in the report, we have a history, how this decision and when this decision were taken, on the hour, on the day. And I don't know if you want...
It's not about that. Sorry, maybe I just put it wrong.
And potassium iron.
What were the main reasons for the low effect?
Microphone, please.
I don't have one. Hello, I'm here. What were the reasons for the comparably low effects of the radiation after Fukushima accident? Who did what to limit the effects?
Well, if you have a release from a point source, and let me assume this is a point source, although you have many, many release points in this complex accident, then the concentration in air near this source is higher than if you go further away. And just to take people out of this 20-kilometer zone saved them the dose they would have received if they would have stayed in this 20-kilometer zone. The same is true for if people stay in houses. The shielding properties of the houses reduce the external and to some extent the inhalation doses. And I was just given the information that I should mention the iodine. Some of them got iodine. The information about this is complex, and in some cases we cannot really be sure if the iodine which has been distributed has been taken. But this is another way to block the thyroid so the iodine cannot go into the thyroid and produce high doses.
Hello, my name is Katsuhiko Hara from the Nikkei News in Japan. What are some of the works that needs to be done before you finalize the report? In other words, can there be some significant changes made from what you have said today?
Well, I mean, we will not change the facts, but in many cases, the wording is very important. The wording we scientists use sometimes can be misunderstood totally by people outside this community, and so the committee made great efforts to point out where these hints have to be given to not be misunderstood. The problem is that we are dealing with low doses, and there the attribution of low doses to effects is not straightforward and simple to explain. So in many parts of the report, there are statements which could be misinterpreted by people who read the report finally, and so we have to really work very hard to use a unified terminology to be understood and not misunderstood.
If not, then another round, and then the gentleman there, please.
Ishiguro of Yomiuri Shimbun again. Relating to this activity of evacuation and sheltering, and you pointed out that by these activities in the earlier stage, the dose was reduced by the factor of as much as 10. Then hypothetically, if this evacuation and sheltering were not done in this way, and the dose was 10 times as much as what happened, then was there going to be any significant impact on the health?
Well, I told you the dose levels we have assessed with this shielding in quote factor. If these doses would have been a factor of 10 higher, some people would have ended up in a dose rate well above 100 millisievert. And at this level, in bigger populations, we have seen increases of cancer in the past. So we would have the discussion, will we see, will we not see cancers? I mean, this is from a scientific point of view, this is the whole case.
Ken Udawa Kyodo News, and there is this dose level was reduced because of the early evacuation, I understand. But there are some people who fled northwest, for example, in Namiet town, where actually more nuclear falls were. And do you have analyzed what if it is if the exposure of the people who fled the northwest was going up or not? I think that the people want to know about that.
Yeah, we have analyzed the doses for down to towns in areas which were more or less exposed to radiation, and this what was going down to town situations. So this information is in the final report.
I thought, no? Okay. Then I have a very quick wrap-up question, and that is to both of you, Mr. Weiss and Mr. Larsson. One is, what is in fact the fate of the report, apart from the fact that you will finalize it and obviously make it public? And as far as the issue is concerned, what is the fate of the issue of Fukushima as far as the committee is concerned?
Well, we discussed it yesterday. I mean, the first step is to finalize this report, which is still quite some work to do. The expert group will stay in business for the rest of the year, and this expert group will look at needs for future work and make a proposal to the committee for discussion and approval, hopefully, next year. So this is not the end, this is ongoing, but the future is open.
I can add to that, of course, the report, as was already pointed out, will now be finalized, and when it is finalized, there will also be publication events associated with that, and we will at that point in time be able to talk about the effects, the exposures in a much more detail, and we'll be able to answer questions in much more detail. And that we expect is going to happen towards the second half of this year, and we are currently discussing how this is going to be organized. But for the committees, from the committee's perspective, this is not going to be the end of the committee's engagement in Fukushima issues. It remains to be decided in the committee how this is going to be taken care of. But the group that has been coordinated here by Dr. Weiss will continue to work, finalization of the report, but will also identify potential outstanding issues that still needs to be dealt with, and that will feed into the work program of the committee. And the first opportunity to discuss the work program of the committee is going to be next year, when the committee meets again. And I would probably make a prediction that that is going to result in the committee at some point in time, a number of years from now, are going to come back to particular issues around the Fukushima accident, but it remains to be worked out. Thank you.
From the Secretariat's point of view, I mean, we've got quite a lot of work to do in pulling the report through the publication processes. There is essentially a requirement that we have to put a report to the General Assembly, which will be in October, and that's a relatively thin thing, which is a report on our meeting, and it has findings on the topics that we've discussed today. And that will be at the end of October. And we would intend to, in parallel, publish all the detailed findings as an open published document that support and underpin those findings for the General Assembly.
Thank you very much. Thank you to all members of the panel for your time and your expertise in this briefing. And thank you to you, members of the media, for attending this press conference. Wish you all the best. Good afternoon. And as I mentioned at the very beginning, the dedicated Secretariat of Unscare is here in the Vienna International Center. So Malcolm and his team will remain here. And throughout the year, if you have any questions and issues related to their work, related to this particular report, please be free to contact them. Thank you very much.